welcome to my channel. It's Keeping Up with K. If you know my name stand for, now you know. Today's video, I'm taking y'all along with me to study for Patho Pharm. Let's get into it. All right, y'all. So first things first, let's go over some study tips and methods. So my first advice, use the resources that your school provides to you. For my particular program, my teacher will make us a study guide. She has slides called start slides. So that's just important things to make note of. And then we have a workbook. So for the workbook, the study guide workbook, we just go through and answer the questions. There's like fill in the blanks, matching, etc. So go through all of that. So once I have my study guide filled out, I like to make note cards. Now this can be very, very time consuming, especially when you just have so much content that you're going over. But something about writing out the facts and information just makes me to remember it better. So once I fill out my note card, I feel like that's part of the studying process, actually writing it out and then just flipping in between it and going over it. So for the third method is ChatGPT. So just go on there, create a exam for me, or NCLEX style exam, whatever, and then upload your professor's lecture notes, or you can just upload your study guide that you already filled out. I think it would be better to just upload the study guide because that's the information you're focusing on, and then just create an exam and practice that way. I'm gonna show y'all later how I use ChatGPT. Another thing I saw on TikTok, they were using AI. I don't know exactly how they do it, but maybe they upload their lecture slides the same way for ChatGPT, and you have it like talk to you and tell a story and explain the content. So that's something interesting. I would have to rewatch that video, but if I find it again, I'll link it down below if y'all interested in that. Another method that I seen on TikTok is active recall. So you just get a whiteboard, you write out all of the major concepts for your exams, and you just write everything from memory that you remember about each concept. And once you get to the end, you just go back to your notes, see what you missed, and then erase everything and do it all over again. And you just keep doing it until you feel like you know the information. I have not tried this method, but I'm open to doing it. So maybe when I'm like on campus or something, that's something I can do. I do have a whiteboard back there that I don't use, so maybe it's something I can look into. If there's ever a concept that you are just confused about, I would suggest watching a YouTube video. Me personally, I like watching Simply Nursing. Something about how those videos are structured and the graphics and the mnemonics and all that other stuff is just really helpful for learning. But if y'all have any channels y'all recommend, comment them down below. I don't watch YouTube videos as much, but if I'm ever confused, I'm gonna look at one of those videos. Lastly, y'all, it's so simple, but a lot of people skip it. Just read the freaking book. Read the books that you're required to get, or get on ATI and read about the concept. It just lays out, whatever you're learning. Now, I'm not big on reading. I get bored or distracted, and sometimes reading will make me tired, but y'all, promise y'all, reading will just, it really will help with the process. But ATI, I like how they structure some of the lessons. I like how they have videos in the lesson, or they have little activity questions in the lesson, or just the way they like bullet point things. I love how they just don't make it super wordy. So I would suggest using ATI. So those are the main methods I've used myself, or I've seen other people use, and they've been successful with their tests. Last semester, I did really good in Patho Pharm, surprisingly. I think I ended with like a 92%, so almost an A, but not quite. But yeah, so let me know down below if you guys have any other tips. But now let's get into the studying portion of the video. All right, y'all, so I have everything opened. I'm gonna just show y'all real quick what I got going. But this right here is our workbook. So it's just like fill in the blank, telling us the stuff that we should focus on. So I already filled out all of these. I don't know if y'all can see really good. I'll flip the camera if need be. And then this over here is our study guide. So these are all the concepts that we're focusing on. And then I filled that out at the bottom, the answers to the concepts. Something I forgot to mention, my teachers, they will make a Kahoot for us so we can go through, do the Kahoot. They also will make an ATI practice test. So there's a whole lot of resources for us to use. But yeah, here is just the study guide, the points that I filled out. I don't think I completely filled this out, but I'm gonna come back to it and fill out the things I need. And then this is the start slides. These are just like the main things that she wants us to focus on. So in her PowerPoint, it'll actually be a star on the slide to tell us that this is something we need to focus on. So first things first, I'm gonna go through this workbook and make some note cards. So let's do that.
If you fuck me, then fuck you. And that's the way I like it. And that's the way I like it. That's the way I like it. That's the way I like it. I'm 30 for 30, I'm 30 for 30, I'm 30 for 30, I'm 30 for 30.
Chat. Should they fold that bitch? No yoga mat. Chat. Should they dare that nigga? Don't hit me back. Chat. Should ran that nigga? No questions asked. Chat. They chatting, they chat. When the sun go down, everything made me feel lonely. Had a little sad thing, but right now it's just a hole. Try to feel good, it's hard enough, no one to hold me. Hype me up, you give me hype. You my favorite coach, compress the line.
Alright y'all, so I opened a blank workbook over here, and this is the one I filled out. So I'm gonna just study as I go. I'm gonna look at my thing, figure out which one of these is the right one, and then I'm gonna click over here to fact check it so that I'm studying as I'm going.
Fucking stress off, that's my only vice. I take it off when you tell me if I'm feeling fine. I run it up, risk it all like I'm rolling dice. Taking it all, that's my second life. That's me, passed out on a nigga backseat. Cash out on the backseat beach. Oh, you know my body, oh, you know that's me. Bitch, tripping like it me. All I want to love is out there.
Some of y'all just go watch.
Y'all, sometimes it's best to just remember a concept and not the thing. So you just kind of think it through. Think about like birth control, for example. Like, what is the purpose of birth control? What is it doing? And at the end, it kind of gives it away. It acts as a barrier to the passage of sperm. So that's something that helps me when I'm studying. And another one, that has reductase, and it has the word reduction in what it does. So that's something that helps me when I'm studying.
Yeah, some of y'all just go talk, but none of y'all ain't really got shit. Some of y'all just look lost. I gave you this type of feel, you ain't accustomed to. I swear I'll be at peace if it But if you fuck me, then fuck you. And that's the way I like it. And that's the way I like it.
You know, smile when none of these bitches.
That's the way I like it.
Wiping them down.
Alright, you guys, got my note cards all finished. I don't have a whole lot of note cards, which is great. The last unit, I guess you could, well, not even full unit, but topic was transgender care. I didn't make note cards for that because everything was pretty straightforward. Like, I can answer those questions without even looking at the PowerPoints. But I'm gonna just use these note cards. I'm trying to get on ChatGPT. I'm not understanding what's going on with my Wi-Fi right now. It's not freaking loaded all of a sudden. But once it does, I'm making an exam and we're gonna do some practicing.
All talk, I like cash talk. Lady diamonds hitting, turn the flash off. I'm like Wing Dixie, I get bags off. Baby got a pretty face, slim waist, ass off. I'ma get my own sack, bitch. I never had the bag. I ain't taking shit back, bitch. I said what I said. I was down bad, and they left your boy for dead. She say, girl, that fat nigga keep a loaf of bread. I still got powerhouses coming through on mopeds. I'ma still run that check up like I got 4 legs. Give me any drug, I'ma get it off. I'ma stop on these folks, niggas every time they piss off. Bitch, I'm tryna score, I ain't got no time to punt. I'm filling up my slap boy with Obama runs. Bitch throw me the alley hoop, yeah. Bitch threw me the alley hoop, I fucked around the dunk. Got the small talk, I like cash talk. Lady diamonds hitting, turn the flash off. I'm like Win Dixie, I get bags off. Baby got a pretty face, slim waist, ass off. I'ma get my own sack, bitch. I never had the bag. I ain't taking shit back, bitch. I said what I said. I was down bad, and they left your boy for dead. She say, girl, that fat nigga keep a loaf of bread.
This real ice, I don't need a flash for this shit. For this cash, got a bad bitch that'll do a trick.
Okay, a nurse is caring for multiple patients. Which patient should be seen first? A 45-year-old with a history of asthma, complaining of shortness of breath. Sounds like that one already. B, a 30-year-old with a post-op day 2 appendectomy, requesting pain medication. C, a 70-year-old with a Foley catheter who reports cloudy urine. D, a 55-year-old scheduled for discharge this afternoon. Okay, so it was A. Airway, breathing, circulations are the highest priority. Yo, this is another good question. Which task can a nurse delegate to the LPN? A, teaching a patient about insulin administration. B, performing an initial assessment. I know it's definitely not that one. C, administering sub-Q heparin. Or D, evaluating a patient's pain level. Excuse the noise in the back. But I'm gonna guess D. I'm trying to scroll without scrolling too far. C.
Designer down, I ain't take the tag off this shit. They ask me why, cause bitch, I paid a bag for this shit. I'm that type of nigga, get a rap check, go buy a brick. I'm the type of nigga, catch you hating, I'ma slide your bitch. You with this shit, oh yeah, ain't shit, what side you with? Bad still coming in, all kind of shit. Foreign car driver, pull up all kind of whips. Trap nigga fashion, put on all kind of drip. Hat do gymnastics, nigga, I'ma make it flip. All these blue honeys on me, got them thinking I'm a crib. Long live nip, all I know is hustle. Ain't real street nigga, got this shit up on my muscle. All the jury on, I ain't got no time to tussle. Looking like a break, jumping out that motherfucker.
Got the small talk, I like cash talk. Lady diamonds hitting, turn the flash off. I'm like Win Dixie, I get bags off. Baby got a pretty face, slim waist, ass off. I'ma get my own sack, bitch. I never had the bag. I ain't taking shit back, bitch. I said what I said. I was down bad, and they left.
Let me pop off, leave the club, sloppy drunk, come home and get my rocks out. Heard
remember if we played this in class. I don't think we did. Okay. Which patient will be created? No. Okay, I was kind of thinking that one too. Just being effective. Oh. I think it was this one. What is this? Was that wrong? Like, I don't know if that was wrong or right. It like start me over. I don't think stop smoking. Who we gonna feed first? I need 2 extra dollars. How much money do I have? This game is confusing, but this low-key fun. I don't remember nothing about that drug. Nope. Pelvic pain. Okay, that makes sense. Is this the right exam? Okay, we were on the wrong exam. Okay, that's more like it. So it's 10 o'clock, it's getting late. I'm gonna finish this practice exam and then I'm probably gonna start getting ready for bed. So far I've been missing a decent amount of questions and it's kind of frying me and it's lowering my confidence, but we're gonna see what happens tomorrow. So first we have our I think the exam is like 60 questions, and then we have this clinical judgment scenario we're gonna do after the quiz as a group. So I am gonna review the possible scenarios and make sure I understand the overview concept. But yeah, I'm probably gonna update y'all by tomorrow. If not, I might end the vlog right here in case I do. I'm probably gonna talk about the results and how I did on my next nursing vlog. That should be the week 4 one. But thank you guys so much for watching. Don't forget to like, comment, subscribe. Tell me some tips that you use to study. And yeah, see you in my next vlog. Bye.